Hello, my name is Dina, and I'm with the Iowa Educational Services for the Blind and Visually Impaired, and we are here to join with Early Access in providing services to children ages birth to 3 years old. But is it always obvious that a child may be having difficulty with vision? Not really, especially when a child is under 6 months of age. The sense of vision is the last one to fully come online for children while the brain is developing early in life. Vision is processed in the back part of the brain, and it takes a while for things to fully develop. By the time a child is 6 months old, they should be able to visually track objects, make eye contact. They should have some depth perception. They should begin to see color and able to smile at a parent from across the room. Since early access is with the family in the child's life, it's important to watch for any visual development that seems slow or that's just not happening. Let's talk about how we all see. There are two things that work together for sight: the structure of the eye, or the ocular side, and the processing of vision information by the brain, or the neurological side. If the eye itself is not receiving good images, then the brain has poor information to process. That is the ocular problem. A visit to an eye doctor may find that there is a problem with the eye. The doctor may be able to prescribe glasses, they may be able to prescribe therapy or surgery for correction, or there may not be an intervention for correction. The structure of the eye may be working well, but the brain may not be processing the information from the eye. This is a neurological vision impairment in which the brain gets the information, but due to the very long path to the back of the brain for processing, the information gets tangled up or lost before it's understood. This results in poor vision, but not because the eye or the structure of the eye has a problem, but it's the processing by the brain of the visual information. It's also possible for a child to have an ocular and a neurological vision impairment at the same time. This complicates the ability of the child to use remaining vision since the brain is struggling to process any of the limited or distorted visual information it receives. Both ocular and neurological vision impairments need intervention by a vision professional. We have teachers of the visually impaired and orientation and mobility specialist in Iowa who can assist the early access team. These are professionals who are specifically trained to evaluate the child's use of vision, determine areas of need, and develop a plan to increase understanding of the world around the child. Thank you for your time.